Alright guys, welcome to Dental Boards Reviews. This is a video on the calculation of lidocaine 2% with epinephrine. Okay, so as a dentist, we administer local anesthetics almost on a daily basis. Every time you do a procedure, you're going to administer that local anesthetic. So I would like you to master, okay, the concentrations and the calculations. And also for those preparing for the board exams, these calculations should be should be automatic. Whenever you see the percentage, or whenever you see the concentration of epinephrine, you already know the milligrams that are in the capsule. Okay, so in terms of let's move forward. Okay, so the dental capsule, okay, the dental capsule has 1.8 milliliters. If you looked at my previous video on local anesthetic, in terms of the cheat sheet, in terms of how to quickly calculate the amount if you're in an exam. Okay, now we're going to go a little bit in details to provide more details, so to allow you to memorize and know this information easily. Okay, so one dental capsule of lidocaine has 1.8 mLs, okay, of local anesthetic solution as the volume. Okay, so for example, the easy way of memorizing it is 0.5% equals 5 milligrams per ml. So which means that there are 5 milligrams of local anesthetic in 1 ml solution. Okay, so 1% equals to 10 milligrams per ml. 2%, which is our common concentration in our lidocaine, or 2% lidocaine that we administer on a daily basis, especially for those people in the US. If you're outside, you may have different concentrations, but the math is the same. Okay, math doesn't change. So 2% is 2 milligrams per ml, which means there are 20 milligrams in 1 ml solution. Okay, and then 3% means 3 milligrams per ml. Now here's a question: how many milligrams of lidocaine are in 1.8 ml capsule of 2% lidocaine? Okay, I keep repeating because repetition is how we learn. Okay, repetition. When you see things, my previous video on how to calculate, I mentioned this, and so repetition is how you learn. Okay, so it says the question is how many milligrams? Milligrams. Okay, so what we have here is 1.8, okay, ml are in one capsule. So 2% equals 2 milligrams per ml. Sorry, 20 milligrams per ml. So which means one capsule, as I mentioned in the previous slide, has 1.8 mLs. So to get the total milligrams, we're going to multiply the 20 milligrams per ml, which is in 2%, times the volume of the capsule, of the solution in the capsule. Okay, which you always assume. If you're on an exam, you always assume 1.8. If they sometimes they specify, they'll give you 1.7, but if they don't specify, it's always 1.8. Okay, so assume 1.8 mLs. And now if you're on an exam, you assume 1.8. Now if you're in a clinic and you want to calculate the capsule, if you look at the capsule itself, it will tell you based on the manufacturers. So most capsules will say 1.8, some capsules will say 1.7, but the capsule, the inscription, the capsules will tell you the volume, the actual volume. Okay, but in the exam they don't give you the capsule, so you always assume 1.8 mLs. So since you multiply these two numbers, okay, so you multiply 20 milligrams per ml times 1.8, it will give you 36 milligrams of lidocaine. Remember, lidocaine is the local anesthetic that we are calculating, okay? All right. So there are 36 milligrams of lidocaine in 1 capsule of 2%. 2% lidocaine. You can, so if you know these numbers, you can just say, somebody says 2% lidocaine, capsule of the dental cartilage, how many milligrams? 36. Okay. If you are sleeping and somebody wake you up, hey, wake up. How many milligrams are in 2% lidocaine solution for the dental capsule? You say 36 milligrams. Okay. So 1 capsule of 2% lidocaine has 36 milligrams. So if you want to add up how many milligrams are in 2 capsules, then you multiply by 2. Okay, that's how you calculate it. All right. So if you have questions on the calculation, please like, subscribe, okay, and comment. All right. So I can answer your questions. Now here's another question. Why is epinephrine added to local anesthetics? Okay. So some of the things that we have in our dental profession is most of our anesthetics come with lidocaine, okay, because we want to prolong the duration of local anesthetic. We want the patient to be numb longer so that they are not in pain when we're doing our procedures. Okay? Remember, dental phobia is one of the reasons most patients don't like dentists. How many of you have been in a car, or you meet somebody in the street, or you meet somebody in the elevator, you tell them, hey, what do you do for a living? I'm a dentist. Oh, I hate dentists, right? Most people don't like dentists because they associate dentistry with pain. So the reason epinephrine is added to local anesthetic, one, is to prolong, okay? It's going to prolong the duration of local anesthetic, okay? So the epinephrine is going to last longer. It's going to, the local anesthetic, the lidocaine is going to last longer when you add epinephrine. Otherwise, if you inject lidocaine without epinephrine, guess what happens? Because lidocaine is what? Is a vasodilator. Lidocaine by itself. Lidocaine by itself. I'm not talking about epinephrine here. Lidocaine by itself is a vasodilator. So it causes vasodilation. So if injected by itself, it's going to increase the size of the blood vessel and increase the blood flow to the area. So as soon as, because there's a large stream of blood coming through that area, the lidocaine you just gave is going to wash away. So it will last about 10-15 minutes. Okay? So you end up giving more. So most people, people, they say, oh, somebody with who is pregnant, I'm not gonna give any lidocaine with epinephrine. But guess what? If you're doing a procedure which is going to last more than 30 minutes, okay, it's better to give the 2 capsules or 1 capsule, okay, of lidocaine with epinephrine, which is going to last longer, and the patient is not in pain, because remember, the pain, if the patient is in pain, they are going to produce endogenous epinephrine, because we produce epinephrine when you're stressed, right? These are stress hormones. So you want to decrease the amount of endogenous production of epinephrine, okay, when the patient is stressed, because actually that's the one which is going to increase more of the heart rate. But the one we inject is local, and it's going to go into the bloodstream very slowly if you add epinephrine. Okay, I want you to understand this point. So I'm taking a little bit time here. So epinephrine is a vasoconstrictor, okay, which is going to make the blood vessels narrower, okay, and in turn, is going to decrease the rate of blood flowing through the blood vessel. And then when that happens, the lidocaine, which is injected at the site, so if you are doing let's see, let's talk about maybe an incisor, okay? So the lidocaine in that area is going to stay longer, okay? Because the blood flow has been diminished, so there's no bloodstream, there's no like a large volume of blood coming through the area to wash away the lidocaine. You understand? So I'm trying to use the layman's language, okay, so that you can easily understand the concepts, okay. Now, so lidocaine, when you add epinephrine, lidocaine is not washed away, okay, it's not washed away from the area as quickly, okay. I want you to understand this again. Lidocaine by itself is a vasodilator. So if you give it by itself, it's going to last a few minutes, 10 to 15 minutes, okay. So if you add epinephrine, it's going to last longer. It's going to give you more than 60 minutes. And sometimes, most of the time, it lasts for 3 to 4 hours. Okay. So you want to add that local anesthetic. Okay. So you have to understand that it washes away slowly. And the amount of epinephrine, we're going to see how you calculate the epinephrine, okay, is very minimal compared to endogenous productions when somebody is stressed. Okay? All right. If you have a question, please comment, and I'll be happy to answer your questions or ease your fears in terms of this area. All right? Okay, so therefore, epinephrine, because epinephrine is a vasodilator, so it narrows the blood vessels. Epinephrine in somebody who is on blood thinners. Okay, so if you use lidocaine with epinephrine, it's going to decrease the amount of bleeding, and also epinephrine decreases or slows the absorption rate of local anesthesia. This is the washing away concept that I told you, that it's not going to be washed away by the blood into the bloodstream. Okay, so it is going to leak into the bloodstream very slowly. Okay, so the patient usually gets numbed up when you add epinephrine, gets numbed up for about 3 to 4 hours. Okay, before the numbness starts wearing off. But if you don't add that epinephrine, it's going to last about 15 minutes, and then you have to inject again. You inject again. So if you're doing a longer procedure, you end up giving more local anesthetic. Guess what? Now all that local anesthetic is in the bloodstream, and there's a risk of increasing toxicity. So you have to make sure, you have to take advantage of the epinephrine. Okay. So epinephrine also increases the duration of numbness. Okay, which will give you enough time to work. So don't be scared to use local anesthetic with epinephrine, and as long as you calculate the amount of the amount of capsules that you can give to each patient for that procedure. Okay, but take your time, numb up the patient really well, okay, and that is going to give you at least 3 hours of working time if you use one capsule or two capsules. And so in this case, you have to master the art of nerve blocking. All right. If you have any questions, let me know. I can answer those questions for you too. The art of nerve blocking and the art of adequate local anesthesia, even if local infiltrations that are more profound. Okay, some people give in or put in the needle, but the local anesthesia is not going into the tissues, and it's just coming out, and your assistant is just suctioning it out, and you come to do the procedure, the patient jumps up, right? So you make sure you master the art of nerve blocking, local infiltrations, the art of profound local anesthesia. Okay, all right. Okay, so here's a question. How many milligrams of epinephrine are in one capsule of 1 to 100,000 epinephrine solution. Okay, so remember, one capsule has 1.8 mLs. Okay, so one standard capsule in dentistry here in the US. I've practiced in the US, so I know most of the standard capsules of lidocaine, but it's the same. So if they give you even a bottle, if your local anesthetic comes in a bottle, as long as that bottle has a volume on it, you can always calculate. Okay. So, but the to know the milligrams, okay, to know the milligrams of epinephrine, pretty much is you have most of the concentration of the capsules are going to be 1 to 100,000, 1 to 200,000, 1 to 250, to 1 to 50, okay, 50,000. So you have to know the milligrams. So 1 to 100,000 pretty much means 1 milligrams in 100,000 ml. So that's the volume, okay. So because you know one capsule has 1.8 milliliters or mLs, okay. So pretty much disregard this. My PowerPoint here added this here, so remove that. But pretty much it's you divide here, okay. So it's 1 milligrams in 100,000 mLs, okay. So you multiply by the total volume of one capsule, which is 1.8. So pretty much, if you know the math, you this milliliters, the mLs, and this one are going to cancel, and pretty much you remain with the milligrams. So one capsule, one dental capsule, okay, of local anesthetic. If it says 1 to 100,000 epinephrine, pretty much that means the milligrams of epinephrine in that capsule is 0.018. 0.018. Okay? So you can pretty much memorize this. So how many milligrams of lidocaine are in 2% of lidocaine with epinephrine is 30 milligrams, 36 milligrams. And how many milligrams of epinephrine are in one capsule of standard dental capsule is 0.018. Okay. Again, I think let me be short with that. It's one capsule, 2% lidocaine with epinephrine, 1 to 100,000 epinephrine has 36 milligrams of lidocaine and 0.018 milligrams of epinephrine. Okay, so you can know how to calculate this, but also you can easily memorize that, because if you're taking your board exam, pretty much you have to know this quick. It should be on the tip of your tongue, or the tip of your of your fingertips. Okay, because if you're clicking with the mouse, you should be able to identify the answer and click quickly. Okay, all right. Okay, so if you have any questions, please leave me a comment. Okay, so please remember to like, subscribe, comment, and share. Okay, if you find this video useful and if you like it, it encourages me to make more videos explaining, because the way I understand things, or the language I use, I try to use as the way I understand things, so you can understand it and use that to memorize these concepts. Okay, so if you have any questions, please leave me a comment. You take care.